would like to present my study about the implementation and evaluation of a workshop addressing caring for patients with diabetes considering fasting in Ramadan. Here is the outline for this presentation. As we know, pharmacists represent a trusted source for health advice, especially in patients seeking help in chronic disease management, including diabetes. Studies show gaps in knowledge of pharmacists and other healthcare professionals as well. In addition, the lack of the healthcare professionals' knowledge was attributed to the absence of any training programs or workshops. That's why training programs are very essential and important to address the gap in healthcare professionals' knowledge. Comprehensive training is essential to be provided to healthcare professionals that covers both pharmacotherapy and communication in order to enhance their knowledge and confidence as well. Little work addressed diabetes and Ramadan education for students. So, in our study, we assessed both knowledge and self-efficacy quantitatively, and we did a brief qualitative assessment on the students' narratives about what they liked and disliked in this module. Our target population was B-Pharm students, which are the Bachelor of Pharmacy students and the Doctor of Pharmacy students known as PharmD students in Beirut Arab University. In addition, no previous studies addressed or gave the detailed clinician-patient communication as an intervention component. So our participants consisted of B-Pharm and PharmD students in Beirut Arab University. B-Pharm students took the module as part of an advanced pharmacy practice experiential course offered twice per year, once in 2020 and once in 2021. And PharmD students took the module as part of several mandatory training activities in 2021 that represent a graduation requirement. To note that PharmD is a postgraduate degree in the Lebanese setting, and PharmD students are practicing pharmacists. Concerning the module design, it consisted of two phases. The first one addressed the risk stratification for patients considering fasting, according to the IDF-DAR guideline 2016 and 2021. Medication regimen management, including both the insulin and non-insulin part, non-pharmacological measures, including diet and exercise, the communication tool, which is the RAMCOM tool that I will be presenting later on, and the instructor role-playing videos. The second phase consisted of a role-playing video prepared by students. After each of these sections, we provided students with a set of test your knowledge question that serves as a learning opportunity for them, and it was not graded. Here is a sample picture from the module addressing the medication adjustment for the non-insulin part. Another sample picture, which is the RAMCOM video. RAMCOM is a tool for systematic communication between healthcare providers and patients in relation to Ramadan. It was introduced to emphasize the role of patient autonomy, informed decision-making, and empathy in caring for those patients. Here is a sample picture of the video, role-playing video. We provided students with 4 of instructor role-playing video that serves as a learning opportunity for them as well. And after each of these videos, we gave students a set of test your knowledge question as well. These videos were provided in the Arabic language. Here is an example of a question following the previous video. Also, these questions were not graded, as I have said before. Here is the role-playing video provided by a B-Pharm student. We did a pre-module assessment for self-efficacy knowledge, and we gathered demographic information. And for the post-module, we assessed also self-efficacy and knowledge quantitatively, and a brief qualitative assessment was also made. An instructional video was provided 4 days ahead of the lesson to explain the module's content, navigation, grading, expectations, and the deadlines. To dig more into details, concerning the self-efficacy instrument, it consisted of 5 items, and participants were asked to rate their degree of confidence based on a 5-point Likert scale, and it was provided in form of a survey before and after the module, and it was not graded. So students were asked, how confident do you feel in your ability to counsel diabetic patients planning to fast on risk stratification, nutrition and exercise, drug regimen adjustments, and signs indicating breaking the fast? While concerning the knowledge instrument, it consisted of 24 items and it addressed several areas of knowledge. It was provided in form of a survey in the pre-module. However, it was in form of a quiz in the post-module, but only for the B-Pharm student, and it was graded. It assessed risk stratification, medication adjustment, diet and exercise, glucose monitoring, and finally, conditions requiring breaking the fast. And in the pre-module, also, we gathered demographic information, and in the post-module, we did a brief qualitative assessment. Here is a sample picture from the knowledge survey assessing the risk stratification. And here is another one assessing the medication adjustment for the insulin part. As for the results, the average age for our participants was 22.5 years. Participation rate was 100%, and the median time spent on the lesson was 2 hours, 36 minutes. As we see here, concerning the average score of the knowledge, in the pre-module, it was 14 and increased post-module to 22, which is statistically significant. So the module had a positive impact on the students' knowledge. Same as for the self-efficacy, it increased from 1.5 pre-module to 3.5 post-module, which is statistically significant as well, and the module had a positive impact on the self-efficacy and the students' confidence. This figures shows the increase in aggregate knowledge scores for students after the module. We see it's shifted to the right, so the module had a positive impact on the students' knowledge, which increased after the module. The role-playing video provided by the students were assessed based on this rubric. As we see, students overall did well. However, they struggled with the certain points, such as providing patients with information on the risk category, maybe due to the insufficient familiarity as a topic compared to medication regimen adjustment. This finding was also similar to other studies. Also, students struggled with reinforcing autonomy and with evaluating concordance. However, they did well in providing information on medication timing and doses. Also, they did well in evaluating patients' understanding of medication regimen and in educating patients on proper dietary management and exercise. All rubric components were worth 1 point, and additional points were deduced with any incorrect information provided by students. As for the qualitative results, students expressed that the module was informative. They felt more comfortable to approach patients with diabetes considering fasting in Ramadan. They appreciated seeing recorded presentations and instructor role-playing videos, especially presenting real-life scenarios. They felt that addressing the cultural needs of patients would have an impact on their relationship with patients. And finally, they expressed that the topic should be addressed earlier. Students felt that the lecture slides and instructor videos with test your knowledge questions helped them to understand the material better. Still, some students felt that there were too many videos. Some students appreciated the focus on their communication skills, especially the emphasis on empathy and reinforcing patient autonomy. One student expressed that it's a new topic that I never thought about or knew about. Today, I asked 3 patients if they are willing to fast and gave them the appropriate advice after calling their physician. Some students found that having to create a role-playing video helped them to rehearse the material and to understand it better and to practice counseling patients with diabetes, while others found it to be complicated and onerous. This module serves as a resource for professional pharmacy students' education and for the continuing education of pharmacists, especially in areas where Muslims do constitute a majority. Use of interprofessional education for teaching students from different health professions about diabetes and Ramadan in a comprehensive manner that combines both therapeutics and communication as demonstrated here. Different versions of this module can be integrated into the continuing education activities for other healthcare professionals. To conclude, the module was generally well received by participants. Improvement in students' knowledge and confidence in carrying out diabetes and Ramadan-related behaviors was seen. Finally, this module could be applied in different settings, particularly where health professionals and students are serving sizable Muslim populations. Finally, I would like to thank Beirut Arab University, to thank Dr. Muhammad Azzat Amin, who involved me in this interesting topic about diabetes and Ramadan, Dr. Lama Soubra, my second supervisor, Dr. Muhammad Hassanin, for always being there for me and helping me throughout this study, Dr. Suraya Dumyati, and my friends and family, thank you so much.